Have you noticed something strange? When you're in pain, every instinct tells you to rest, stay still, avoid moving. It makes sense, right? If moving hurts, then not moving should help. But here's what scientists and doctors have learned. Most of the time, the opposite is true. The movement we avoid when we're hurting is often exactly what we need to feel better. Today, I want to show you why staying active is one of your strongest tools against chronic pain. The pain paradox. Let's look at what happens when we stop moving. Say you've hurt your back. It's painful, so you rest. You spend days on the couch avoiding anything that might make it worse. At first, this seems smart, but then something odd happens. Your muscles get weaker, your joints stiffen up, you can't move as easily, and your pain often gets worse, not better. Researchers call this the pain inactivity cycle, and millions of people get stuck in it every year. Harvard Medical School experts note that physical activity can break this vicious cycle where pain stops people from exercising, but lack of exercise causes muscles to lose strength and flexibility, making movement even more painful. When we hurt, we move less. Less movement weakens us. That weakness increases our pain, so we move even less. But there's good news. We can break this cycle. Movement is the key. The science of movement and pain. What actually happens in your body when you move, especially when you're in pain? First, movement increases blood flow. When you exercise, even gently, your heart pumps more oxygen-rich blood to your muscles, joints, and tissues. Better circulation brings in nutrients and flushes out inflammatory chemicals that contribute to pain. Second, movement releases endorphins. According to Harvard Health Publishing, these are your body's natural painkillers, released by the hypothalamus and pituitary gland. The name comes from endogenous morphine because they mimic opioid painkillers. About 20 types exist, with beta endorphin being most studied. Harvard researchers explain that moderately intense exercise is best for releasing endorphins. These natural chemicals can be as effective as medication for managing pain while improving your mood and reducing stress. Third, movement changes how your brain processes pain. Chronic pain can make your nervous system hypersensitive. Regular, controlled movement helps retrain your nervous system. Your brain learns that movement is safe, and the pain signals decrease. Finally, movement strengthens the muscles that support your joints and spine. Stronger muscles mean better support, which takes strain off painful areas and prevents future injuries. Real-world evidence and Harvard research. This isn't just theory. Major research institutions, including Harvard Medical School, have proven that movement works for pain management. Harvard Health researchers found that exercise decreases pain severity while improving functioning in people with chronic pain conditions. According to Dr. James Rainville, assistant professor at Harvard Medical School, relief from back pain often comes not from physical healing, but from a neurological process where the nervous system adapts to pain through movement. People with chronic lower back pain show real improvement with regular exercise. Treatment has undergone a sea change, with exercise now recognized as key to treating back pain. Clinical guidelines now recommend staying active as a first-line treatment, ahead of many medications. A study from Norway involving over 10,000 adults found that people who exercised regularly showed higher pain tolerance. The more frequently they exercised, the more their resilience to pain grew. For arthritis, research shows that appropriate exercise reduces pain, improves function, and slows disease progression. Even for fibromyalgia, studies show that aerobic exercise and strength training reduce pain levels. Research found that Tai Chi, yoga, Pilates, and core exercises significantly help people with chronic low back pain. The best exercise is the one you'll actually do. Getting started safely. I know what you're thinking, this sounds great, but I'm in pain. How do I start? The approach matters. Harvard Medical School experts emphasize gradual progression. You don't need to push through severe pain or jump into intense workouts. All successful exercise programs are gradual, set reasonable step-by-step goals, emphasize stretching and range of motion exercises, and focus on strengthening muscles and building endurance. Start small. If you're dealing with chronic pain, even 5 or 10 minutes of gentle movement makes a difference. A short walk, gentle stretching, or simple movements in a pool are excellent starting points. Harvard research confirms exercise is generally safe, provided you don't push too hard. Listen to your body, but know the difference between discomfort and harm. Some muscle soreness when starting is normal. Sharp, severe pain or pain that lasts long after activity means you need to modify. Work with professionals if you can. Physical therapists and pain specialists can design programs tailored to your condition. They can teach you which movements are safe and how to progress gradually. Be patient and consistent. Movement doesn't fix pain overnight. It might take weeks or months to notice changes, but people who stick with it see big improvements. Here's what I want you to take away. Your body is designed to move. Pain is your body's alarm system, but staying still isn't always the answer. More often than not, gentle, consistent movement is the path to reducing pain and getting your quality of life back. The next time pain tempts you to stay on the sidelines, remember you have more control than you think. Start small, be consistent, and trust your body's ability to heal through movement. Your path to less pain doesn't begin with a magic pill. It begins with a single step, one movement at a time. That power is already yours. If you found this helpful, hit that like button. Want more evidence-based health content? Subscribe and turn on notifications. Drop a comment below. What's one small movement you're going to try today? Thanks for watching, and here's to moving toward a life with less pain.